Hi, everybody. Welcome to week 10. All right, this week we are talking about being student oriented, and there's tons of different ways we can be student oriented. To me, one of the things that first comes to mind is being student oriented in my teaching. What that means to me is when I approach teaching a topic, I try to think about how can a student best learn that material and how to use it versus how can I best teach that material. And just looking at it from that slightly different perspective can really change how you approach the teaching. And it does tend to almost force you to use more active teaching strategies, which I think can only benefit your students and help to engage them. And a couple examples of how I've used this in the past. A long time ago, I was a pediatric charge nurse at Children's Hospital of Philadelphia on the night shift. And I didn't feel that the staff on the night shift had dealt really well with some recent emergency situations that have come up, because they don't come up all that often. Hopefully you prevent them. But I didn't feel that the staff were really that well prepared, and so I started doing mock codes. Our unit had a treatment room where we would do IVs, insert NGs, different things like that. Anyway, and so I would take a mannequin into the treatment room and set up an emergency scenario kind of in the middle of the night when everything was quiet. And then I would announce to everybody, okay, I've got a patient in here and this is what's going on with them. And they would all come in and we would problem solve on how to address the student, the patient. Anyway, so it was good hands-on learning. When I taught in the undergraduate, I would teach med-surg, advanced med-surg, fundamentals, different things like that. And I can recall one time when I was teaching about different aspects of taking care of diabetic patients. And I did a portion of the class for the lecture, but then I set up different stations. There was one station where you had to take a patient's blood sugar and then calculate insulin based on a sliding scale. There was another one where you had to look at a meal and calculate the number of carbs to be able to use a carb, essentially sliding scale. In another station, you had an insulin drip that you had to manage based on the last blood sugar, and you had to rearrange that. And then there was one other one I think had to deal with like teaching and psychosocial and developing a teaching plan. Anyway, so the students worked in groups and they had to go from table to table, area to area, and complete these various stations. Well, what that gave them was some real hands-on experience in dealing with common diabetic scenarios that would come up during the clinical setting. And so I think in this program, you've probably heard enough about active learning strategies and engaging students to know that that's really important. But sometimes it's hard in our mind to transition over from lecturing sage on the stage over to facilitating guide on the side. And so I think that's part of being student oriented. There's so many other aspects, and I'm sure you will bring up many of them in your posts for this week. All right, you are going to be having in week 11 that test analysis assignment, and hopefully you've started on that and are well on your way. I am going to attach something I don't think I shared with you before. It's a slide presentation about improving test evaluation, and it talks about multiple choice questions and just some real helpful hints and tips and some different things like that. So hopefully that will prove useful to you. If you do find yourself in a situation where you are going to be writing a lot of tests, and these days very few educators rely on test banks anymore. Many of them are compromised, can be purchased by students, or they also are not written at the application level and higher from a cognitive standpoint. and a lot of them are written at knowledge and understanding level, which doesn't really help us to differentiate the prepared from the unprepared student. And so if you find yourself in that situation, there are actually a lot more written now, articles and things like that, about creating really solid multiple choice test questions. Because our NCLEX is still predominantly multiple choice, that is the format that you have to get really good at. Whether it's a test that you're going to be giving after nursing orientation, or that you're going to be giving students in academia, or maybe you're trying to do a post-test after some type of education session with a group of patients. Those are skills you're probably going to need to develop. All right, student-oriented, looking forward to seeing your posts in the main forum. And if you have any last-minute questions as you're working on that week 11 assignment, please don't hesitate to ask. See you in the main forum.